Good afternoon, and thank you again to Dr. Apostolakis of UR Medicine and Dr. Mayo of Rochester Regional Health for joining us today for this important conversation. And as always, thank you to our colleagues in media for helping us to spread the word. As we have done throughout this pandemic, we have worked together as a community to respond to new and evolving challenges. Today is no different. The constant through the entire pandemic has been change most notably in the virus itself and the impact it has had on our communities. Early in the pandemic, measures were instituted across the state to ensure the health and safety of New Yorkers, given what was known and unknown at the time. And today represents another evolution of that same desire to ensure the health and safety of all New Yorkers. And we are in a very different time now than we were nearly 3 years ago. We have a vaccine that is effective now and decreasing the spread and improving the outcomes of individuals and communities. It is not a perfect vaccine, nor has it ever been. We also know that masks, when used appropriately, can also decrease the spread of COVID. The State Department of Health will be discontinuing the requirement to wear masks in healthcare settings, but this does not change the reality that COVID is still here and that it will continue to impact individuals in this community and in many others. Those who are especially at risk, either due to medical or social circumstances, will remain at great risk, and we owe it to them and their families to respect their decisions to remain healthy. This is true especially in hospitals, where we know the sick go to seek care, and where those of us entrusted to provide that care must be responsible to prevent the spread of infection where it can be expected and is reasonable to do so. As has been the case all along, each hospital system is again in the position and to determine precisely what steps are necessary to prevent the spread of COVID and other infections among their patients, visitors, and staff. The risks within each hospital and each healthcare setting can be highly variable, and so it will take some time for our hospitals to evaluate their circumstances to come up with an approach that makes sense for all of the different inpatient, outpatient, and public settings within their facilities. I have been and will continue to work closely with both URMC and RRH to ensure that hospitals remain committed to keeping our community healthy and safe, because after all, we are one community. In some sense, today is the day we have anticipated for a long time. Today is the day when we have the ability to make decisions based on local circumstances and in response to local data. With that ability comes responsibility. We have a responsibility to our patients, to our staff, and to our families to treat one another with respect, because that is ultimately how we will need to remain together to make it through the duration of this pandemic. So with that, I want to open up the floor to our media colleagues to ask either myself or Dr. Apostolakis or Dr. Mayo any questions. Well, it is true that the news is coming, somewhat quickly. I just learned of this news earlier this week, and it wasn't really even confirmed until, yesterday for all of us. So I understand that local practices, as well as the hospitals, are in a position of trying to make a decision relatively quickly. But I will say that, there's nothing really more important than keeping our patients and staff healthy and safe. And so while I sense the urgency to try to do something, right now, we are actually doing the safest thing possible. And, as the hospitals have some time and as the practices have some time to evaluate their individual circumstances, I believe everybody will make the right decision based on their individual circumstances. But, the urgency that we have here is really a privilege. And, it will take a little bit of time for everybody to get back on board. But I think keeping everybody healthy and safe is by far the most important priority.
Yes, great question, Natalie. Even before this mandate we knew was going to be lifted, we've been looking very closely at our visitation policies, and there are certain softening of the visitation restrictions that have been going on over time. And we will be releasing new guidelines for visitation, I believe this Thursday, which will allow in many areas of the hospital 2 visitors. Right now, they will continue to need to be masked while visiting loved ones. But there are certain areas of the hospital where we will not allow 2 visitors, such as the ED, the peri-op areas, et cetera. But we are softening and loosening the visitor restrictions.
Yeah, thank you, Dr. Apostolakis, and for that response. And it is very similar at Rochester Regional Hospitals. We recognize the importance of family support and love and encouragement during difficult times in a person's life. So we're eager to support our patients with appropriate visitation. And we also are regularly reviewing that. And visitation may remain different based on the location of the patient and the conditions in that location. And as Dr. Apostolakis referred to the emergency departments, they are remaining very full and busy. And so visitation practices will be different there at Rochester Regional Hospitals as well. But we do want to invite as soon as possible as many visitors as is reasonable.
Thank you, Dr. Mayo. Do we have a reporter on from Spectrum? I think they may just be recording, so we're going to go to Raquel Stephen at WXXI.
Hi, thank you. Thank you. Good afternoon. I guess I just needed some clarification on the guidance. So the mask guidance is lifted, but hospitals or healthcare systems have the option in whether or not they choose to require masks. I just wanted is that correct?
Yeah, what the state has done is they're allowing the mask mandate to expire. They're not recommending that hospitals don't require it. They're allowing each individual hospital and organization to decide their particular circumstances with the types of patients they're caring for, the types of hospital or healthcare facility you are, to make a decision that's best for your patients, your faculty, your staff, your visitors, and your community. And so they've given us the ability now to make that decision. They're not saying that we can't mandate masks in the hospital. But they're not making the mandate themselves. They're leaving it up to us to make that decision. And what you heard Dr. Mendoza say is that we want to take time to carefully look at the situation at our hospitals and in our outpatient office practices and look at each individual decision. But our primary concern is making sure that the patients we care for are safe. We take care of many sick patients, vulnerable patients, elderly patients, patients with immunosuppressed disease. And I've heard from many patients who are very concerned about this and would feel unsafe if cared for by providers who are unmasked or visitors that come unmasked. So we realize that this may be an inconvenience for some. Our community has helped us respond to this COVID emergency, and I'm reaching out to them to ask them for their patience and understanding that this is not an easy decision for everyone, that some will have some concerns about this continued mandated masking, but we're not a convenience store or a grocery. We take care of very sick and vulnerable patients, but we're also a large organization that has many different areas, and we want to look at it very carefully, take time to make a policy that makes sense and does what's best for our patients, our faculty, our staff, and the community.
I also want to chime in, Raquel. Thank you for your question. And just remind everyone that the use of surgical masks or face masks as a tool in healthcare has been vital for decades and decades. Certainly surgical masks are well known to the public, but there have been diseases for, generations that have required respiratory isolation and appropriate mask utilization. And so masks will always be a vital part of good healthcare. And so we're in this moment now of reconsidering how masks are used, from the broad mandates from the COVID pandemic to how we balance that moving forward in the best interest of patients. And certainly the spectrum of respiratory diseases because of COVID is changed forever with COVID now as part of the human experience. And so it will not be unexpected for the public to recognize that the use of masks will be different than it's been in decades previous to this.
Thank you. Raquel, do you have a follow-up?
Yeah, just a quick follow-up. I know, Dr. Apostolakis, you said just an open-ended question. What is the situation at these hospitals? What are we looking at? Are we seeing an increase of patients? I know you said Dr. Mayo is pretty busy in the ED. What's happening? Can you give us like a sense of, is it still overwhelmed? What are we seeing right now?
Yeah, our hospitals in the URMC and our affiliates remain full. We are usually at 100 or over %, but it's getting closer to how it was pre-pandemic. We are still very stressed by the inability to have patients that require nursing home care move to nursing homes, although we're working with local government and state government to find solutions to help our nursing homes be able to recruit and retain staff so that those patients can move to a more appropriate setting. The ED situation, we remain full. It's not quite as crowded as it was a month or two ago. So things are slowly getting better and getting back to a more normal stance. As far as COVID goes, we've had a pretty steady number of patients in the hospital with COVID, but the majority of them are not admitted because of COVID. They happen to come in with COVID. And we've seen the virulence or the ability of COVID to cause severe illness go down, but we still have on average about 20 patients who were admitted because of COVID. And even though COVID virulence or the ability to cause severe disease in most people has gone down and is now closer to the flu, for our vulnerable patients, our immunosuppressed patients, our elderly patients, they still remain at very high risk to have severe illness from COVID. And that's who we're really most concerned about the spread to right now.
Okay, our next question comes from Dalton Williams at 13 WAM.
Good afternoon, everybody. Thank you for having me. Just a few quick questions. I know both doctors have said that we're analyzing the kind of environment and before we make the final decision. Do we have a timeline of if we do decide to lift these masking mandates at URMC at Rochester Regional? Do we know kind of roughly about when that could happen, or is it kind of still, like we've been talking about this entire time, just a big waiting game?
Yeah, I would say that at this point in time, I guess I wouldn't call it a waiting game because there's a lot of work and activity going on in the background, but I realize from the public perspective, it is waiting, and I do appreciate the patience. And I would say that we don't have a timeline at this moment, but there is a commitment between the health systems to work together to bring a recommendation forward as as soon as is reasonable.
And I'd like to thank both Dr. Mendoza and my colleague, Dr. Mayo at Rochester Regional. We're really fortunate that the healthcare systems work together. And so we've been on the phone a lot discussing this because we think this is a community issue and we don't want the community confused by different policies amongst the different healthcare systems. So, we would like to look at the situation in great detail and make sure we don't make a mistake. The one thing that's been clear about masking in hospitals is that it's helped stop the spread of disease in our hospitals and protect our patients. And there may be areas in the hospitals or in the office practices that it may be okay that we allow visitors to go without masks. But I do think we need to look at this carefully because both our organizations are very large with a lot of different environments. So it's quite complicated. And I agree with my colleagues here. There really isn't an urgency other than for people who are concerned about wearing masks. And the majority of the patients that I talk to tell me they are very concerned about receiving care anywhere where they're not protected from their caregivers and other visitors and other patients, that could have a communicable disease, and they feel comfortable coming to healthcare settings in which masking is required. And I think we need to remember that.
Do you have a second question, Dalton?
Nope, that answered pretty much all my questions. Thank you so much.
Thank you. Jen Lukey from WHEC, you're next.
Hi, guys. I hope you can hear me okay. I wanted to follow up with a question about sort of the other big elephant in the room when it comes to the state, which is the vaccine mandate for healthcare workers was deemed, I guess, an overreach by the state. I asked the governor about it. She still talked about how she believed that it is in the best interest of patients to have healthcare workers vaccinated. But the lawsuit technically says it's now up to individual facilities about this sort of thing. Are you all waiting, Dr. Apostolakis and Dr. Mayo, for the state to give you specific guidance on that? And I know you have said in the past that it wasn't an enormous amount of your workers who you lost to the vaccine mandate, but I don't think the same is true in the nursing home setting, and that sort of ripple effects to the hospitals, obviously. So I'm just looking to see where both of you stand on rehiring healthcare workers that may not be vaccinated against COVID-19.
Yeah, that's a great question, Jennifer. I think first, I'd just like to say that we are advocates for vaccination, and we believe that it reduces the spread of disease, and we favor people being vaccinated. As far as the specific question about the vaccine mandate, which right now has been struck down, but the Department of Health has filed a notice of appeal that they will file an appeal, and we are looking at this very carefully. People have been asking about us if they can work if they don't have vaccination, and technically right now they can, but we're letting people know that this could change. Because if they appeal this decision and it changes, then we're back to where we were. And then people who have been hired that aren't vaccinated, either have to get vaccinated or won't be able to work. So we're trying to avoid the yo-yo, and we would like this settled by the state before we come up with, our formal response.
I do think that healthcare workers have a particular obligation to do all that they can to keep their patients safe and healthy and recovering, whatever the case may be from the patient's perspective. And there are many organizations across the country and some states that have mandates for example, for influenza vaccination. And so, I do reflect on that. We do not have a state mandate for influenza vaccination, nor is there a Rochester regional mandate for that particular vaccination. but I think most people would be aware that schools have requirements for children to have vaccinations. Even the smoking laws are similar in their principle in that they protect non-smokers from the smoke of others, right? And so I do think that the commitment to the well-being of others is expressed in the way healthcare workers make personal choices. And so, our organization encourages all vaccinations as much, and we certainly follow the laws around that. So we do support vaccination.
Yeah, Dr. Mayo, I guess the question was more like, I'm sure everyone on this call from a medical perspective supports vaccination, but I guess it's more of a whether or not you support it, are you willing or able at this point to hire back people who are not vaccinated?
At this point, we're not hiring back individuals that are unvaccinated.
Okay, thank you. And Dr. Mendoza, one bigger, broader sort of question for you when it comes to these overcrowding situations, the nursing home situation. I've talked to a lot of folks within EMS as well, and it's sort of like they feel like there needs to be sort of a more cohesive approach to reaching some of these problems. And I know you guys have done a lot of that during the pandemic. Do you feel like there are any further opportunities when it comes to staffing shortages sort of across the board that you're working on or can work on to sort of address some of these issues?
Absolutely. The work around COVID that we engaged in as partners across the community between hospital settings and nursing homes and all of that really has just continued. The focus hasn't been as much on COVID, but it's now, as you said, focusing very much on staffing and making sure that people are able to get to the right settings of care. So that group meets regularly. We're still looking at ways to fund the nursing homes. The funding is the issue really in nursing homes, and we've been underfunding nursing homes for 20 years. So that is something that's going to take time to unravel. We certainly have an acuity now that we can't wait 20 years to fix. So, we're working with, Albany and local groups to try to figure out, are there ways to support our nursing homes to take on this additional patient load at a time when it's really very difficult for them to do so. So that work is ongoing, and hopefully we'll have more to share with that in the coming months.
Thanks, guys.
Thank you. And our final question is posted in the chat from David Robinson, who is with Gannett. He wonders if you could elaborate on the factors that will be evaluated for determining potentially lifting the mask mandate. For example, will the decision be attached specifically to case hospitalization metrics for COVID, flu, or other respiratory illnesses? Either one of the doctors?
That's a great question. I'm not entirely sure how that will, evolve over time. Yeah.
It's going to be it'll be a combination of factors.
Yeah.
That include what's happening to COVID in the community. Has the virulence of the disease changed? What types of patients you're caring for in a particular area? I think those would be the major factors.
What I'll add is that, this isn't really our first rodeo with regard to trying to figure out how to institute precautions across the community within our hospital settings. In normal years, the state health department will declare influenza as prevalent, and that is typically the cue for us at the local level to convene our hospitals and say, well, now is when we would institute the visitor restrictions that are you're typically used to seeing every year before COVID. So we'll be doing the same thing. Obviously, it won't be the same metrics because the COVID metrics are different. We don't get data in the same way for COVID that we do for influenza. We know that testing for influenza changes throughout the season, as has been the case for COVID. So, we do have some experience to borrow from. But that being said, the bottom line is that we don't want to withdraw any precautions prematurely. And so we'll be looking very closely. We'll want to look at all of the different hospital settings, the risk in a the dialysis unit is going to be very different than the risk in the cafeteria. So we've just got to look at all of the settings across all of the settings of care across our hospital systems and long-term care. And, we want to make that decision thoughtfully with the best interests of our patients and community in mind.
Okay, that does it for questions. Thank you all very much.
Good weekend.